Hello, everybody. This is Amanda Cooper with Cola Daily, and I'm here downtown Columbia at the Trinity Educational Center with Vivian Armstead and Reverend Berrien Henderson. We're trying to get information out to the community when it comes to health, and I know you guys have a wonderful event coming up focused on actually men's health. Could you tell our audience more about that?
Well, this event is coming up. It's in partnership with our men's ministry and with our Project Tech here at Trinity Education Center. We're partnering with some national partners, the National Minority Equality Forum, the HIV Vaccine Clinical Trials, the Balm In Gilead. So we have some national partners, and then we have ministry partners within it, with June being Men's Health Awareness Month. And so we decided that we would host this health forum called Healthy Men Leading Healthy Families, because they are the head of the household, and so generational norms can be changed through the man of the house being healthy and being able to, because you know black men die quicker than any other racial ethnic group from health disparities. African Americans are disproportionately impacted by every single health disparity, and South Carolina has a poor outcome for health for African Americans. So on June 24th, from 10 till 2, we will be hosting a health forum, not just men's health, but we will have a focus on men's health, sexual health, mental health, emotional health. We will have the renowned Dr. Thaddeus Bell out of Charleston, South Carolina. He's a family physician down there in Charleston, and he has a radio show called Closing the Gaps in Health Disparities. And he's been working in health disparities for many, many years. And the Minority Equality Forum, our Faith Health Alliance, also is working on health equity. And so we will be having Dr. Bell as our keynote speaker, and we'll be having a special guest speaker, Dr. J.L. Bishop, J.L. Carter, out of the Ark Church in Baltimore, Maryland, who is the leader of the Faith Alliance that is under the National Minority Equality Forum.
Wow, I mean, that's a very impressive lineup you're going to have there, giving out a lot of great information. Now, you touched on a lot of things in regards to men's health, specifically black men's health. And Reverend Henderson, as a black man, could you expound on some of the things that you talked about, specifically about how they die, you know, earlier than most races?
Absolutely. Well, personally, you know, my father died when he was 63. So that was relatively young, and it is relatively young as a result of stroke, blood pressure, not being controlled, which is what we find in the black community, as along with diabetes, heart disease. So our focus, as Vivian was saying, is going to be on men's health, as our mission here at Trinity Baptist Church is for men to be in their rightful place. So that's just really going over into the health segment now, with health being the key component to the man being in his rightful place, not only physically, but also spiritually.
When we talk about equity, I want to just have you share, because a lot of times when you have host events like this, people, they think it's for older people. They think it's time to, you know, get more concerned about your health as you get older. But I want you to address preventative health care, which I'm sure this summit will also address. And one of the main reasons why men of all ages should be coming to these types of events.
Absolutely. Well, one thing we do here at the Trinity Baptist Church is we have a diabetes prevention program. That is through the Balm In Gilead, which is one of our partners here. So not only are we providing the information, but we're actually having in-person sessions where persons can come in and learn how to eat, as Vivian mentioned about eating healthy. We also have a couple of raised beds here on the property as well, where we teach people how to grow their vegetables, free of pesticides and things of that nature. Along with that, as relates to being preventative, we're also teaching our young people. They've actually got a raised bed out there as well, where we're going to actually plant fresh vegetables, where they can actually tend, their own vegetables and things of that nature, so they can learn how to eat healthy as well. So not only do we have these initiatives going on, but we're actually starting with our youth in getting them involved and getting them engaged and having some interaction with them on healthy eating. Another thing that we're doing is that we just started, as of yesterday, we started our Dance Fit with Southern Girl Dance Fit, Miss Monique Williamson. We had about 20 persons come out yesterday. So not only are we teaching you how to eat properly, we're also giving you the component where you can actually come out and you can exercise as well, 2 to 3 days a week, and do something that's fun. You know, do it in a fun manner. Everybody likes line dance, and if you don't have 2 left feet like myself, but you can come out and learn and have fun being healthy and being preventative, taking these preventative measures so that when you get to be 50 and 60, you've already gotten the routine, you've already gotten the pattern down as to what you need to do to prevent certain diseases and disparities in your family.
Throughout the year, we have a cancer breast walk, which we keep the seniors and everybody active doing that. We have World AIDS Day where we have information and speakers coming for that. Working with the Hutch Cancer Research Center with the HIV Vaccine Clinical Trial Network. We have we had a cancer project going with the USC School of Public Health. So we have a lot of partners, you know, that we work with. But the Faith Health Alliance is what Bishop Carter is coming for. And so lunch is free, the information is free, the fellowship is free. And so we're trying to make a move that will remove barriers from people seeking information, from seeking it as if it were silver, and that we inform people, because when you know better, you do better. And so we're trying to bring this knowledge into our communities so that we can save lives and so that we can save the next generation.
Wow. Well, this is fantastic. It was such a good pleasure to speak with you guys about this again. June 24th, 10 a.m. to 2 p.m. Register before you come because you want to make sure that there's enough for everybody when it comes to food and lunch. And it's just a fantastic event. The entire family is invited, specifically
yes.
The man, the wife, everybody, even your neighbors. Bring your neighbors if you need to, right?
Yeah.
So it has been a pleasure speaking with you all today. And I just want to highlight something that you guys have mentioned throughout this whole conversation. This is an annual event.
Yeah,
absolutely.
But you guys have events catered to health and wellness all the time. So they need each one, and they need to visit the website to learn when these activities are taking place, so that they can continue learning and continue being active and continue growing and being better in regards to the way that they treat their bodies.
Yes. There's an old African proverb that says, "A man who hides his disease cannot be cured." And so we want to come out and talk about what has been ailing us, as my grandmother would say.